General treatment overview. Let's talk about how we treat the varicose veins found in your legs. Once we learn about your medical history and perform a physical examination, we perform a detailed ultrasound evaluation to better understand your unique anatomy and the extent of your varicose veins. Occasionally, we may need to perform other imaging tests, such as CT, MRI, and venography if we suspect problems with pelvic or deeper central veins. Using this information, we develop your treatment plan. Varicose vein treatment is broken up into steps. Often, the externally visible veins are the last to be treated. Primary sources of reflux typically need to be addressed before treating visible surface veins. The complete course of treatment is usually spread over a period of 1 to 6 months. Patients should expect their legs to possibly look and even feel worse during treatment. Complete recovery can often take several months, depending on your unique condition. Typically, we perform a combination of treatments to fully treat varicose veins. Of course, our physicians and providers will work with you to create your personalized treatment plan and schedule any necessary follow-up ultrasound appointments. Let's look at an overview of the most common varicose vein treatments. Endovenous ablation. When a long, straight segment of a superficial vein needs to be treated, we perform an in-office procedure called endovenous ablation. A small diameter tube, or catheter, is inserted into the target vein, through which treatment is performed. The ablation procedure takes approximately 1 hour from start to finish. After it's finished, a steri-strip is placed over the entry site, and a prescription-strength compression stocking is placed on your leg, which you will need to wear for a few days. You are then released to go home. We'll want you to stay active and resume most daily activity immediately. Ultrasound-guided sclerotherapy. Ultrasound-guided foam sclerotherapy is an in-office procedure used to close symptomatic varicose veins. Foam sclerotherapy is often performed on veins that are not externally visible and cannot be treated with an endovenous ablation catheter. Polydocanol and sodium tetradecyl are the most common sclerosing agents we use. These agents are relatively safe and have been approved for use in liquid form by the FDA. However, because we foam these agents in order to increase their effectiveness, their use as foamed agents is considered off-label by the FDA. However, it is considered a standard of care in the United States and is offered by most physicians who specialize in vein treatment. Using ultrasound, a small needle is inserted into the problematic vein, and a small amount of the foamed sclerosant medication is injected. Following sclerotherapy, you will wear a prescription-strength compression stocking for a short time. Again, we'll want you to stay active and resume most daily activity immediately after treatment. Ambulatory phlebectomy. Ambulatory phlebectomy is used to remove segments of superficial bulging veins. By physical exam or by using a special light or ultrasound, we identify the veins to be removed. Local anesthetic is injected to numb the surrounding area. Once the region is numbed, the diseased veins are removed through several small 2 to 3 millimeter incisions. Upon completion of the procedure, steri-strips are applied to the incisions. A medical-grade compression stocking is then placed over the leg, which you will be instructed to wear for several days. It is important to stay active by walking and performing most daily activities after your procedure. You should keep the incisions clean and dry for the first several days to prevent infection and minimize scarring.